Good afternoon, live from Toronto on the GBKM network. Welcome to the Chatt Up Show, the show where we chat about any and everything to do with popular culture. I'm your host, Elizabeth Aloyde, and I hope that you are ready to chat it up with me today. Now, as always, remember you can keep up with the GBKM network in various ways. You can listen and watch live at www.gbkm.fm or www.gbkm.tv, where you can also share, like, and comments to join in the conversation. You can also continue to watch us live on Facebook at GBKM Television and YouTube at GBKM TV, where you can also subscribe to our YouTube channel. And of course, like, share, and comments to, of course, again, join in the conversation. And on our website, you can also check out our past shows in case you missed a show that you didn't want to miss, but we know life gets in the way. Or you want to check out the upcoming shows throughout the week, you can do that all at www.gbkm.fm. And if there is a certain host that may have caught your attention and you want to find out a little bit more about them, you can do that by checking out our on-air personality page on our website. Again, that's www.gbkm.fm. And I want to say that you can also follow us on Instagram at GBKMFM and Twitter at GBKM_FM to let us know how you're feeling, what you think about the different shows that you're tuning into. And I also want to take this opportunity to thank our official Chatt Up Show sponsor, Coded Signature, that's coded with a K, who creates these lovely hats that you see right here on our trusty mannequin. You know what? We're gonna have to name this mannequin, okay? This is basically our guest every single week, so I want y'all to come up with a great name for this mannequin and we will name our mannequin. But anyway, back to our sponsor, Coded Signature, where you can get some of these really cool hats that we have here on display, just like this one, which has the Queen Idia of Benin emblem on it. Now, Coded Signature is a expert at creating all the Afrocentric apparel and accessories that you'll need. And the best part about it is you don't even have to worry about location because they ship worldwide, and you can get 10% off at checkout of your purchase on using the GBKM code at checkout. Again, you can use the GBKM code for 10% off. All of this is available on their website, codedsignature.com. That's coded with a K, signature.com, or you can check out their Facebook and Instagram at Coded Signature. Now, this has been a week, hasn't it? I mean, every week has been a week, let's be honest. This 2020 has been a week of weeks, am I right? But this particular week, we finally got to hear who the predicted president of the United States is, and it's not former President Donald Trump, let's just say that, though there are quite a few GOP members and, religious leaders who seem to think otherwise and who are hoping to allow this case to reach Supreme Court so that the courts can hopefully, I guess, in their heads rule in favor for Donald Trump to be reelected as president. But as far as the Electoral College and popular vote are concerned, President Joe Biden is now president, and Vice President Kamala Harris is taking up as the first woman of color to be vice president in the United States in all of the history. So I think that's a big major moment, monumental moment for American history right now, and we all got to watch it. Even though it took a while for them to count all those votes, and there was a lot of conspiracy theories going around, the numbers do not lie as far as we're concerned. So there we have it. Congratulations to President-elect Joe Biden and Vice President-elect Kamala Harris. Now, that's not all the news that has taken over the airwaves and social media and headlines. News of this vaccine. Yes, there might be a vaccine that can help with the cure of COVID. It was recently announced that Pfizer has gone through the third phase of clinical trials of this vaccine that has about a 90% success rate, which is way higher than any of us could have even imagined. It's even higher than the regular flu shot, which usually has a 50% success rate and requires every single year for you to get a new flu shot. But though this is good news, there's still a lot that needs to be considered in terms of different factors that we're obviously going to get into a little bit later on in the show. But before that, we're going to give a little bit of an update of what's going on in our province here in Canada, as we have a new way of, regulating the phases we are in during this pandemic. We're going through the phase 1, phase 2, phase 3, but now we have this new system in place that is color coded, and it's similar to the systems that are used across the world. In Europe and in Africa, just to name a few continents, have been using this color coordinated, coded, however you want to describe it, system to, see where we're at in terms of if we need to lock down again or if we're in the clear. And it's safe to reopen things and be out and about socializing, as we hope to be doing soon. Fingers crossed. So with that being said, I hope that you are comfortable. I hope that you grabbed yourself a little snack, because we're about to get into it and we're about to have some really good chatting going on, okay? So first, without further ado, we're just going to give you a few updates of where we're at in terms of daily cases here in Ontario. A little somber as cases have continued to rise, and we're at a new total of 1,388 new COVID cases on Tuesday, which was yesterday. 520 that were recorded here in our home, Toronto, 395 in the Peel region, 100 in the York region, 722 in Halton region, and 50 in Durham region. So mostly in the GTA area, we're seeing these higher number of cases. And again, Toronto being the hotspot of the province, but with these plans to reduce testing and the testing numbers that we've seen in the provinces, it's still unsure how many, cases, because they're urging people who may be asymptomatic not to really come in and giving priority to those who are exhibiting symptoms to get tested ASAP. But there's still so much uncertainty around this virus, around how we're dealing with this virus. There's still so much to talk about. But one thing we do know is that the Ontario government has released the new color-coded COVID-19 framework document last week that outlined when both preventative and responsive measures should be lifted or introduced in different regions across the province. Now, this new document, which is titled Keeping Ontario Safe and Open Framework, categorizes public health unit regions into 5 levels based on their local COVID-19 situation. So there's green, which is the prevent, yellow, which is protect, orange, which is restrict, and red is control. And then, of course, there's the lockdown, which is a measure of last and urgent resort. So we're hoping that we don't have to go into lockdown. But I want to bring up a graphic for you here just to show you really quickly what that would look like and what these different measures are put in place. So, of course, prevent, that's the green. We're hoping that we can get back to this stage where we can focus on education and awareness of public health and workplace safety measures in place. Also, restrictions reflect broadest allowance of activities in stage 3 absent a widely available vaccine or treatment. And highest risk settings remain closed, which basically means that we're back into phase 3, essentially, of the reopening plan, where things are a little bit more lenient. There's not as much heavy-handed restrictions in place. Then you move on to the protects phase, which is the yellow phase, and that's also enhanced targeted enforcement, fines that are introduced, enhanced education to limit further transmission, and apply public health measures in high-risk settings, so ensuring that, places that have higher volume of people visiting, they have more measures put in place to ensure that everyone is staying safe. Then moving on to our orange section, which is restrict, and that's intermediate measures. It's implement enhanced measures, restrictions, and enforcement, avoiding any closures. So we don't want to have as many closures, but ensuring that everything that is open requires everyone to stay safe, keeping the social distancing, keeping up with social distancing, ensuring that people are wearing their masks, all of the regulations that we've basically been seeing this for the last few months. And then control, which is the red phase, which is implement broader scale measures and restrictions across multiple sectors to control transmission, which basically means that more things, more entertainment, leisurely activities, you'll see more restrictions on those. And restrictions are the most severe available before wide-scale business or organizational closure. Basically, this is the moment before the storm, essentially. Right before lockdown, if you will. And then, of course, lockdown, where there are very heavy restrictions in place, wide-scale measures and restrictions, including closures to halt or interrupt transmission. It's basically a modified stage modified of stage 1 or pre-stage 1, which was where we were at in March, April, around that time. Consider declaration of a state of emergency as well, which was also where we were at a little bit earlier in the year. So that's not what we're trying to do, right? We're trying to get closer to the prevent stage, where we are doing everything to prevent more transmission and more cases on a daily basis, trying to flatten that curve. So that just gives you a little bit more of an idea of what this new framework looks like and what it would mean for those of us in Ontario, and especially for those of us in Toronto, since we are currently the hotspot of the province. And I've been saying this for so many weeks. We got to do better. I know it's hard, it's rough, it's easy for us to slip back into routine. It's easy for us to, want to get back into socializing as much as we used to. Sometimes we forget to wear our masks as much, we forget to wash our hands as much, but it's also important to remember that we're not completely in the clear. And actually, we are even recently been put into the control section, the red zone, of our reopening phases. So that just goes to show where we're at currently in this framework of things, that we're going to see some more restrictions happening, even though our premier has said over and over again, Premier Doug Ford, that he doesn't want to go back into lockdown and he wants to be able to help small businesses stay open as much as possible. There's only so much we can do if we're not seeing those cases reduce over time. Now, the province says the goal is to have every single region in the green prevent level, and regions will be placed in different levels based on how many weekly cases there are per 100,000 people and the percentage of COVID-19 tests coming back positive. They say that once it reaches about 10% of a positivity rate, then that's when we're starting to worry. And currently, I think the last time we checked, Toronto was actually at 13% of a positivity rate. So yeah, that just goes to show that, we're not really in the clear and we're not close to getting to the prevent stage just yet. But hopefully if we, pull up our bootstraps and dig down and make sure that we're keeping up with these precautions and these restrictions and listening to our health officials, healthcare officials, and our government as well as much as possible, and ensuring that we adhere to the restrictions that they have put in place. Now, the number of new, as cases of COVID-19 continue to soar in Ontario, and more specifically in Toronto, the city will soon be entering the red control level, as I mentioned. As of the 14th of November, we will be in the red control level. Now, Mayor John Tory and Dr. Eileen Villa announced that Toronto will be entering a stricter stage of the province's framework than was previously announced, and they also introduced a number of additional rules, including keeping indoor dining shut on top of what is already required by the provincial government in this stringent measured level, and even in the control level as well. So under the control level of the province's framework, indoor dining, gyms and fitness studios, meeting/event spaces, and casino and gaming establishments are all permitted to reopen with a number of rules in place, essentially just limiting the number of people allowed indoors, limiting the hours of operation, limiting the group fitness activities, and team sports will be prohibited, which basically means gyms may not be closed, but the number of people allowed within the facilities will definitely be limited. But that is still, we're unsure if that's still going to continue, if the cases continue to rise even throughout this week and into next week as well. So another image that I like to share with you is an image of what this framework would look like for restaurants, bars, and food or drink establishments, which is what a lot of people are thinking about now. You want to be able to socialize. It's the holiday season. We've already had Thanksgiving. Christmas is basically around the corner. You want to be able to meet up with some friends, maybe have a Christmas party, whatnot. But if we are in the red zone, it basically means that, it's not exactly guaranteed. So essentially with these restrictions, what we see is that, of course, limiting the number of people indoors to 10. Outdoor dining and takeout will kind of be an option, but as much as the safety precautions that can be put in place as possible. Of course, hours of operation will be limited. Even hours that alcohol will be sold and served will be limited as well. Just a lot of restrictions and limitations, and we don't want to continue to keep going back and forth within reopening and then closing things again. It's getting confusing for a lot of people. We're not sure what we're allowed to do anymore. We're not sure where we're allowed to go, but this is all being put in place to ensure that we all can stay safe and ensure we continue to see that curve flatten. I mean, we've seen it before. It happened before where we were starting to see, only double digits of daily cases once upon a time, if we can remember that time. But it's happened before, and hopefully if we continue with these restrictions and ensure that we're doing what we need to do, we can see that happen again. Of course, under the red zone rules, cinemas and performing arts venues must also remain closed, and any personal care services requiring the removal of masks are also prohibited. So, basically just it's essentially going back into phase 2, a modified phase 2, as we said before, that this is what the province's plan for the hotspot areas of the province especially was that, moving out of phase 3 and back into a phase 2, but we're ensuring we do not go back into phase 1 or phase 1 stage of this pandemic, which is essentially just the lockdown. So doing everything we can to ensure that we stay here for a little bit and keep moving until we get back into the green, into the prevent stage of things, so that we can go back into our restaurants, enjoy the indoor dining experience, enjoy being able to socialize with people who aren't just in our household, safely, of course. But all this to say that, these precautions and these restrictions are put in place for public safety and public health as well. Now, Dr. Davila outlined a number of recommendations for residents of Toronto to help curb the spread of COVID-19, which she has described as alarming. Yes, she said that the rise in the number of daily cases is quite alarming. Now, Dr. De Silva is using her powers under Section 22 of the Health Protection and Promotion Act to override some of these guidelines. So as a result, of course, indoor dining, group fitness classes, meeting spaces, staying closed, even though before, when we were in the orange phase, we would have been allowed to loosen up some of these restrictions before, but as per Dr. Eileen's recommendations and suggestions, she's saying that no, even if we are in the orange phase and we still see cases as the numbers we've seen at over 1,000 daily cases, then those will have to remain closed and they cannot reopen. So for all of our gym buffs out there, and for those who like to, hang out at the casino, go gamble a little bit, even just hang out at the cinema, I'm so sorry. We can't do that for now, but hopefully in the near future, we'll be able to do so soon. Now, Dr. Davila has said that this will remain closed for a period of at least 28 days beginning November 14th. So a lot of these restrictions are going into place later on this week, which is basically, this is your heads up to let you know. By the way, these restrictions are going in place pretty soon, so prepare yourself, if you will. If you need to mentally, physically, whatever, get in those last few reps in the gym, if you will, whatever you need to do to prepare yourself, that these restrictions will be going in to effect later on this week. Now, Dr. Davila did say that everyone should limit the people they come into contact with to only other people in their households, which is tough for those of you who may live alone. I understand it's not easy. Being locked indoors alone by yourself, it's not fun. You have to entertain yourself. You might find yourself speaking to walls once in a while, but this is a reminder that this is to keep everyone as safe as possible. And technology is still there, still functioning. You can still have your Zoom parties. You can still have your Netflix watching parties. You can still find ways to socialize without physically being in contact with folks outside of your household. This is just to, stop the transmission cycle and the spread of the virus as much as possible. She also said that everyone should be limiting all in-person activities and only leaving the house for essential reasons such as work, school, healthcare, shopping for food or medicine, and even just your daily walk around the neighborhood. Remember when everyone was going on a daily walk because they just wanted to get out the house during lockdown? Yeah, we might be seeing that again. You might be seeing your neighbors a little bit more on those walks now, even though it's getting a little chillier outside, even though we've been blessed with great weather this past week. We know that winter is coming, so those walks outside, maybe you might need to bundle up a little bit more, but now you have no, you don't need to come up with an excuse if you don't want to be outside and hanging out socially. You could just say, I'm doing my parts to take care of my community and to take care of my own health by staying indoors. So there you go. Got another excuse if you want to stay at home and not be out in the cold, because who really likes to be out in the winter? Dr. Eileen also went on to say, and I quote in a statement, she said, "In my professional opinion, the greatest harm would be to allow COVID-19 to continue to spread at this rate. It's logical to assume that it will only get worse." So this is her warning. She also went on to go and say that to everyone in Toronto, I want to warn you in the plainest possible terms that COVID-19 is out there at levels we have not seen before. You should assume it is everywhere and that without proper precautions and protections, you are at risk of infection. So this is a warning from our top Toronto doctor, Dr. Eileen De Silva, and also Mayor John Tory went on to say Toronto Public Health will be reviewing the framework as well as all the current data available in the pandemic in our city, going on to say that I've been very clear throughout that I want restaurants and gyms to open safely and stay open safely. Safely being the key word. I continue to hope that will be possible in the days ahead. But as we know that might not be possible and they might have to close as we continue to see a rise in our daily cases here. I know it's not the exciting news that we want to see in the world, but the mayor did go on to say that I'm pleased the province has taken account of our challenging local context by offering us some extra time, considering how populated Toronto is and there's so many people in the city. It's understandable that we might see more cases than other areas in the province, but at the same time, we don't want to be seeing as much as we are right now, which is why we're seeing these new restrictions being put in place, and we're even seeing this new framework being put in place just to ensure that public safety and health is always number one. Mayor John Tory also went on to say that we will be working closely with Toronto Public Health to determine what we have to do to open doors while keeping Torontonians safe and healthy, including timing considerations. Now, this new framework that we have put in place, we've seen, as I said, over a lot of other countries and even continents in Europe and Africa, but we're also seeing more of the cases rising globally. It seems that most of the world is now riding this second wave that we've been, fearing for a little bit. And some of them have even returned back into lockdown. For example, the UK, Poland, France, and Greece, just to name a few countries in the EU and Europe who are back in their lockdown phase of this pandemic. And that's not what we want to see. We don't want to get to that stage where we have to completely shut down and go back to that. We want to be able to have a little bit of leniency and a little bit of, room to move. We don't want to be constrained in our homes as much as we were earlier this year. So all of this is just to say that it's important and imperative that we adhere to these precautions and preventions and ensure that we're doing everything we can. So, wearing our masks as much as possible, always, in fact, washing our hands any chance we get, ensuring that we're keeping our physical distance, all of the stuff that we know that we should be doing all along throughout this pandemic. I know, again, some of us may be tired of it, but at the same time, we're not completely in the clear. We're not completely where we want to be. We're not in the green zone. So we want to be able to get back into the green zone, ensure that we're able to reopen as much as possible right now. But as for now, these restrictions are in place. So it's looking like you're going to be having a lot more takeout dinners and staying at home, staying indoors as much as possible, unless you want to go out for your, essentials, for your daily walk, for your groceries and whatnot. So that is just a quick outline of what this new framework looks like here in Toronto for us dealing with this new color-coded framework. But I say all this to say that there is some hope. There is a silver lining on the horizon. Earlier this week, news that Pfizer's vaccine candidate has shown promising preliminary results in phase 3 of clinical trials made headlines, with the news stating that the vaccine may be 90% effective, which is far greater than we could have ever hoped, especially in this stage. However, this was based on early and incomplete tests, but nevertheless, it was some global news that has filled us with a little bit of hope currently right now. for a while there, we were thinking maybe this is going to continue until 2021. We won't see any hope there, maybe not see a vaccine that would be potentially coming onto the market for, public use just yet. Of course, it's not completely approved by the FDA, and it's not been approved fully globally, but this is just a little bit of hope. Wanted to start a little bit with like the doom and gloom of things, but now just a little bit more hope that there is a vaccine out there. So does that mean that we finally have a cure for COVID-19? We're not sure yet, and I'll get into exactly why that is the answer. But first, Dr. Bill Gruber, who is Pfizer's Senior Vice President of Clinical Development, said, "We're in a position potentially to be able to offer some hope." He told the Associated Press that we're very encouraged. Now, Pfizer, which is developing the vaccine with its German partner, BioNTech, is now on track to apply later this month for emergency use approval from the US FDA. And once it has the necessary safety information in hand, they can go on to applying for that and hopefully getting the approval for emergency use, because, a lot of places are in a state of emergency, especially the US, where cases continue to rise. So trying to get this vaccine out to people as quickly as possible, but of course as safely as possible. So even if all goes well, though, authorities have stressed it is unlikely any vaccine will arrive much before the end of this year, and the limited initial supplies will be rationed. Because of course we can't vaccinate everybody in the world straight off the bat. It's going to take a little bit more time to see the vaccine roll out. Now, Dr. Anthony Fauci, who is the US government's top infectious disease expert, said the results suggesting 90% effectiveness are just, quote, extraordinary. So that's a little bit of hope. And he also went on to say that not very many people expected it would be as high as that. He said that it's going to have a major impact on everything we do with respect to COVID. Now, Fauci said, as Pfizer appeared to, be taking the lead in the all-out global race that we've been seeing this whole year, essentially, by pharmaceutical companies in various countries to develop a well-tested vaccine against the virus. I mean, we were seeing tests happen here, even in Saskatchewan, in Canada, all over the world. People have been trying to come up with a vaccine to help with hopefully curing the novel coronavirus that we've been dealing with this whole year. Now, Dr. Bruce Aylward, who's WHO's senior advisor, said that Pfizer's vaccine could fundamentally change the direction of the crisis by March, when the UN agency hopes to start vaccinating high-risk groups. So we're probably looking at March when we're going to start seeing a little bit more public rollout of this vaccine. So, I mean, I can't lie. I'm excited. I'm hoping. We're hopeful. We're all hopeful that this is a vaccine that's going to work out, in the favor of everyone. It's going to hopefully help with curing this virus that we've been dealing with for just so long. It's been 8 months that many of us have even been cooped up at home as much as we can. It's been 8 months that we've been thinking about, wearing our masks everywhere we go. We've been worried about, keeping our 6 feet or 2 meters of distance from each other. It's been 8 long months with a lot that's happened in between, but the main thing is we remember that we are still in the middle of this pandemic. It's very real. As Dr. Davila said, that this is still very real, that COVID is still out there, and it hasn't disappeared, even though as much as we'd like to hope that it hasn't, and it's still very much alive and well, if you will, out in these streets, if you will. So it's just important to remember that this is a little shred of hope that we can hold on to, but it doesn't mean that we can completely be relaxed in terms of keeping up with our health and safety precautions. Now, the strong results of this vaccine were surprising, as scientists have warned for months that any COVID shot may be only as good as the flu vaccines, which are about 50% effective and require yearly immunizations. I mean, earlier this year, Fauci said he would be happy with a COVID vaccine that was 60% effective. So if we're seeing a 90% effectivity rate, then great news, right? This is exciting. It's great to be able to see this happening so quicker than we thought it would. Now, whatever the ultimate level of protection, no one knows if people will need a regular vaccination like we do with the flu shot, get them yearly. We don't know if this is a one-time thing or if we'll need to continue getting them and re-upping on this vaccination. Now, of course, this may seem that we're getting closer to a potential cure for COVID-19. However, there are a few things that need to happen before we start lining up for injections worldwide. Now, for today's chat, we are going to focus on some of the recommendations for the Canadian population as put in place by our immunization committee here in Canada. It's also important to know that we still do not know all of the data that is required to know about the effectiveness of this vaccine. You know, there's still a lot of data that needs to be reported and published out there for our public health officials to look over and view, just to see how effective it will be for majority of the population, because, you know, it's still in phase 3 of its clinical trials. So even though our fingers are crossed, we still also need to be a little bit realistic to know that this isn't just going to happen overnight. It might take a little bit more time, as we know that it might be until at least March, according to WHO senior advisor. So hold on to this hope, but it's not, as I said before, maybe not towards the end of this year will we be seeing this vaccine publicly available all over the world, that we're going to maybe see some controlled group and populations in certain areas of the world getting the first rollout in the first round of these vaccines. Now, some of the specific data is data on which patients benefited from the Pfizer trials, which could inform the rollout plans. Those are still yet to be released, just to get a better understanding of just how the trials worked in favor of those who received the vaccine and who received the placebo within these trials, just to understand a little bit more about what the vaccine will do and how it will help in general. Now, Prime Minister Justin Trudeau said that the country needs a very sophisticated rollout plan that will require high degrees of logistical support. And Dr. Zain Chagala, who is an infectious disease specialist at St. Joseph's Healthcare in Hamilton, told CBC's The National that the rollout is going to be the most difficult part of this vaccine, and that's the part I think everyone is starting to think of today. Dr. Chagala also went on to say that if the vaccine data shows that the highest risk populations also have the highest reasonable benefit here, I think that prioritization scheme works very well, and hopefully that's the target for the first 10 million doses. Now, the federal government has reportedly secured enough syringes and needles for provinces and territories to vaccinate all Canadians who wish to receive a COVID-19 vaccine, but the specific plans are still unclear as to how they will roll it out. Now, before we go into the recommendations of this rollout plan, we're going to just go on a quick break for us to just digest a little bit of that information. You know, 90% is a great effective rate. We're excited to see how it happens, but we also know that this isn't going to happen overnight. So stay tuned and we'll be right back.
Do you know who you are? What is your name?
Sometimes you wonder why and wonder how. Don't be alone. Just stay calm, cause even if you choose or not to.
My child, recite the words of this ancient mythology. The wisdom I disperse in this verse, no apology. Memorized to keep you from evil theology. For you, the Dakahuya denied your equality. See, for generations we perpetrated psychology. Divide and conquer each other, really lynch policy. You cannot build each other up, how will you build economy?
Tupper Consulting is a global education consultancy. We provide pretty intensive short training courses that help people gain leadership, strategic, and technical skills. High in-demand skills such as project management, business analysis, software quality assurance, IT service management, agile, etc.
My name is Angela and I'm a business analyst. A good friend of mine introduced me to Top Run. He had taken the course before and he thought it would be a good idea for me to try it out. At the time, I was looking to change my career and just get a little bit more knowledgeable on how to be a business analyst.
I wanted
GBKM TV, the station with a vision. GBKM TV, the station with a difference now. Slim Flex said so. Big up Ghana.
Hello and welcome back to the Chatt Up Show. I'm your host, Elizabeth Aloidi, and today we are discussing whether we have finally found a cure for COVID-19. Now, we know now that Pfizer has recently announced that they have a vaccine that actually is 90% effective in its third phase of clinical trials. Now, this is exciting news, but what does that mean for us here in Canada, for Canadians who are waiting to get the injection and get vaccinated as quickly as possible? Now, we're still unsure. There's still some data as to the effectiveness of this vaccine and as to the people who should be first in line and prioritized to get this vaccine. But according to the National Advisory Committee on Immunization, a statement regarding recommendations for this potential vaccine, it recommends that to minimize serious illnesses, their goal, is to minimize serious illness and overall deaths while minimizing societal disruption as a result of the COVID-19 pandemic. So they've come out with this essentially a list of recommendations for the Canadian government to put into place to ensure that those who need to get the vaccine as quickly as possible can get it, and to ensure that everyone has all the education and knowledge required to have as much transparency between the government, public health officials, and communities in terms of this vaccine and the vaccination process. Now, the arrival of the vaccine supply is expected, according to the NACI, to be staggered over several months. NACI also recommends that key populations in whom vaccine is deemed safe and effective based on clinical evidence available at the time of vaccine availability should be prioritized for the COVID-19 immunization, which essentially means that people have been categorized into, key populations, our healthcare workers, those who are most vulnerable, those who come in contact with those who are most vulnerable, those who are coming into contact with a lot of people on a daily basis, i.e. our essential workers. Those are part of the key populations that they've been looking at to ensure that the rollout of this vaccine will reach the people who need to get it as quickly as possible, safely, of course. Now, NACI, according to NACI, a sequential approach cannot be determined until vaccine characteristics, results of clinical trials, and the number of available doses are known. So right now, we do not know how many available doses there are to us in Canada, because, they're not really out yet. It hasn't received the FDA approval just yet. We still don't really fully understand the characteristics of the vaccine, or the results of the clinical trial have not been publicly published just quite yet, but that once they have been made public and they can be used to factor in the rollout, then we can start seeing hopefully more people being able to get this vaccination. Now, according to NACI as well, the key populations may change as the evidence base for COVID-19 based on epidemiology, transmission dynamics, again, vaccine characteristics like immunogenicity, safety, efficacy, effectiveness in preventing severe illnesses, and interruption of transmission in different populations. So basically, if we get to know, what the side effects of this vaccine is, start to understand that a little bit more, understand just how effective it is, i.e. if it's like the flu shot where we need to get a new dose every year or so, or if it's a one-time dose thing. There's still so much that we're uncertain about when it comes to this particular vaccine, and this is the information that will be required to know a little bit more of the potential rollouts for this vaccine. Now, sequencing of populations and prioritization within these populations will be based on, according to the NACI, a population-based risk-benefit analysis taken in consideration of risk of exposure, risk of transmission to others, risk of severe illness and death, and the safety and effectiveness of the vaccines in key populations. So this is what they're going to be thinking about when they're coming up with the way to, basically the rollout, the breakdown. So thinking about what kind of exposure people have, whether they're at higher risk of exposure, they're at higher risk of transmitting the virus to others, if they are themselves a higher risk of severe illnesses or pre-existing illnesses, or even death, and just knowing the safety and effectiveness of this vaccine in general. Again, the number of available vaccine types, number and timing of the available doses. So also, there's certain vaccines that require a certain window of time that they should be injected. So understanding the timing of this dose, whether it's something that can be stocked up or if they have to be produced quickly and administered quickly. It also need to understand the COVID-19 epidemic conditions when the vaccine does become available, whether we are in the green zone or if we're still currently in lockdown, understanding how many cases there are, understanding the transmission cycle of the virus as well is important, and the factors that go into deciding which key populations can receive the first doses and whatnot. Now, I've been saying key populations a lot, so to give you an example of what these key populations include, they are those who are at high risk of severe illness and death from COVID-19. So those who are at an advanced age, ages 60 and over, other high-risk conditions to be determined as the evidence base evolves as well. So we don't know if someone who has asthma might be at risk when taking this vaccine, or if someone who has maybe diabetes or something, other pre-existing conditions that may affect the effectiveness of this vaccine. It's also important that, they're part of these populations to test it out essentially. It's also noted by the NACI that Canadians prioritize those with underlying medical conditions, which is about 57% of the population, and the elderly 53% for early immunization if supply of the COVID-19 vaccine is limited. So these are the people that will be prioritized in the Canadian population if this vaccine is made available. So if you're sitting at home wondering, am I part of this population? Then if this applies to you, yes, you are. The NACI also goes on to say that older Canadians are significantly more willing, according to their research, than younger Canadians to get an effective recommended COVID vaccine, and that those 35 years and older with a serious long-term illness are somewhat more willing to get an effective recommended COVID-19 vaccine. So within this population, it also shows that there are some people who are more willing to get a vaccine straight off the bat, and those who are maybe unsure of it, they are, affectionately called the anti-vaxxers within the online community, but there are some people who may not be willing to get a vaccine straight off the bat. So that also is something to factor into just knowing how many doses are required, how many people will be getting the vaccine once it is available, how many people are open to it, things like that. Now, another part of this key population is those who are most likely to transmit COVID-19 to those at high risk of severe illness and death from COVID-19, and workers, essential workers, working to maintaining the COVID-19 response. So these are our healthcare workers, personal care workers, and caregivers providing care in long-term care facilities or other congregate care facilities for seniors. They are also part of these key populations that the NACI says we need to factor in when considering the rollout. It also goes on to say that other workers who are most essential in managing the COVID-19 response or providing frontline care for COVID-19 patients, household contacts of those at high risk of severe illness and death from COVID-19 are also part of the key populations. Now, the importance is immunizing those able to transmit COVID-19 to those at high risk of severe illness and death could indirectly protect those at high risk if this vaccine is effective in interrupting the transmission, which could be particularly important if vaccine characteristics are not favorable in these populations. So if we are also able to immunize those who come in contact with those who are at higher risk of severe illness or death from COVID-19, it's also important that we understand just how much this vaccine plays into the transmission cycle, of COVID-19. Something that we're still trying to understand. There was a lot of confusion during the earlier days of the pandemic, whether those who are asymptomatic were part of the transmission cycle or not. We found later on that they were, whether masks help in reducing, cutting the transmission cycle as well. We found out that they are helpful as well. So there's still some uncertainty in some areas, especially when it comes to this vaccine and how effective it will be within the transmission cycle as well, just to know whether they need to start immunizing those who come in contact with people who are at higher risk of severe illness and death from COVID-19. Now, another key population is those contributing to the maintenance of other essential services for the functioning of society. Now, this is the certain individuals who cannot work virtually and may have differential exposure to COVID-19. This is our police officers, firefighters, grocery store staff who come into contact with a high volume of people on a daily basis, which leaves them at risk and also leaves the people they come in contact at risk. They are also part of the key populations that the NACI are hoping will be, prioritized when this vaccine is available. Also, those whose living or working conditions put them at elevated risk of infection and where infection could have disproportionate consequences, including indigenous communities. Also, people who are living in close quarters to one another as well. Now, the risk of transmission is high in these settings where physical distancing and other infection prevention and control measures are challenging, and individuals may not be able to exercise sufficient personal actions to adequately protect themselves from the infection. So they are also part of the key populations that we're hoping to get this vaccine out to expeditiously. This increased risk, according to the NACI, may expand to other settings as we start to see more reopening happening. For example, remote or isolated populations or those in some congregate living settings may not have ready access to sufficient healthcare or infrastructure. Therefore, their risk for death and societal disruption is proportionately greater since the response to any illness within the community might be suboptimal. So those who do not have easy access to healthcare are also in this key population because they are also at a high risk of transmitting the disease or catching it themselves as well. So it's just a lot of factors going into this, understanding the different kind of populations we have in Canada and who will be able to get these vaccines when they are publicly available. Just part of the recommendations that the NACI are giving to our governments to ensure that those who need to get it as quickly as possible are getting it. Because, it's important we take care of our most at high risk communities, especially just to ensure that we're keeping everyone as safe as possible. But again, I'm going to reiterate that we still do not know enough about this vaccine to really know where we're going to go from here. These are still just recommendations. This isn't concrete plans that the government has, put into place just yet. We're still waiting to know how effective this vaccine is for the greater population and, not just for these key populations that we're listing currently. Now, in Canada, there are a higher number of COVID-19 outbreaks or clusters in institutions such as correctional facilities, work settings in the agriculture or meat production or packing facilities, in congregate living settings like shelters, quarters for migrant workers, as we've seen even in long-term care homes in the Indigenous communities. They have also been disproportionately impacted by past pandemics, for example, the 2009 H1N1 influenza pandemic, and they also require special consideration, according to the NACI, of issues related to equity, feasibility, and acceptability. So essentially what the NACI is saying here, that we also need to look out for our communities that maybe have not been able to get the health care that they've needed in the past. They haven't been able to, receive the care and protection that they've needed in the past. For example, our homeless population. There's been a lot of discussion about how the province has, and the country has let down a lot of the homeless population during this pandemic. When everything was closed, there wasn't a lot of place for the homeless to go. Even the shelters were at the capacity, of course, while trying to socially distance. It's not that easy while trying to accommodate as many people as possible. In our correctional facilities, seeing COVID-19 outbreaks where they're not allowed out of their cells for at least the 1 hour that some may be in a day. They are in close quarters with one another, some having to share basic necessities within those close quarters as well, which would aid in the transmission of the COVID-19 disease. So the NACI is saying that these vulnerable communities need to also be put first in consideration of who gets these vaccines as soon as possible. Now, Of course, there are other considerations for the public health program level in decision making, and the NACI says that efforts should be made to increase access to immunization services to reduce health inequities without further stigmatization or discrimination, and to engage systemically marginalized populations and racialized populations in immunization program planning. So essentially saying that do not only give this vaccine to the most privileged of the population, but to also consider that there are others who are not as privileged and who are compromised as well during this pandemic, and who will need the help from the government, especially to ensure that they are staying as safe and healthy as possible, and will have access to the education and knowledge for this vaccine, and also have access to the immunization process as well. Now, NACI also goes on to recommend that jurisdictions should begin planning for the implementation of a COVID-19 immunization program, including close and rapid monitoring of safety, effectiveness, and coverage of the vaccines in different key populations, as well as effective and efficient immunization of populations in remote and isolated communities. So essentially, it's not that they're just going to go drop off these vaccines and then that's it, their job is done. No, it's important that the government continues to track the effectiveness of this vaccine, especially in marginalized communities, especially in communities that are often left, to the side and often forgotten, which, a lot of people feel very strongly about, that there are a lot of communities that during this pandemic were forgotten and left to fend for themselves, essentially, and that the government didn't necessarily prioritize their needs as much as required. So the NACI is saying, government, this is something that you really do desperately need to take into account when putting your immunization program in place for this COVID-19 vaccine. Now, NACI also goes to say that efforts should be made to improve knowledge about the benefits of vaccines in general and of the COVID-19 vaccine specifically, once available, to address misinformation about immunization and communicate transparently about COVID-19 vaccine allocation decisions. Now, I'm just going to bring up a quick graphic here, which basically just shows everything that I've been talking about the key populations for the COVID-19 immunization. It also mentions here on this graphic that some of the key populations are not mutually exclusive, and may overlap. So you might see some healthcare workers who are also at higher risk because they have pre-existing conditions, or you might see those who are in marginalized communities who also have pre-existing conditions and are also healthcare workers. So getting them these vaccines or access to this information about the vaccine education and access to the literal vaccine to get immunized is important. And it's important that we do it in phases or sequencing and prioritization based on these key populations within the country. There's a lot more information here about who is defined and prioritized for this vaccine that I went through the key populations, that it's important that public health officials and the government take into consideration when they're putting their plan and program into place, especially those who are living and working in conditions that put them at elevated risks, that they are quite literally at the top of the pyramid of those who require the vaccine as soon as possible, those who are at high risk of severe illnesses and death, those who are most likely to transmit COVID-19 to others as well. So all of this information is also available on the Canada.gov website for you to check out for yourself, just to understand a little bit more about the recommendations that NACI has put out. Now, this was put out before the news of this 90% effective vaccine came out. It was put out earlier, in a few months ago, actually. These recommendations were updated. So this is just something that the NACI, again, is recommending for governments to take into consideration when they are planning and when this vaccine is actually available to distribute and for immunization in the communities and populations even around the world in general. And Again, it's important that we know the vaccine characteristics, as it says at the bottom there, and the results of these clinical trials that are being put in place. I mean, Pfizer may have that 90% effective vaccine, but there might be another pharmaceutical company that comes out with a vaccine that's also similar effectiveness as well that could potentially put on the market as well. So just understanding what the different characteristics for these vaccines are and understanding how they may impact these key populations, especially before we start thinking about, putting it out there for the whole population and for others as well. There's just a lot that we still need to know. Still hopeful, still holding on to hope, but there's still a lot that needs to be taken into account, taking into consideration when thinking of the rollout for vaccines, which is why we're saying that maybe not the end of this year, it might be even March, or it might be later on in 2021 before we start seeing this vaccine becoming available to the wider population and not just these key populations, those who are at higher risk of transmitting or even catching COVID-19 or seeing some severe illnesses as a consequence of the virus or even death. So just back to some more of these recommendations from the NACI. Now, we know that it's important that the population and community is educated on the effectiveness of this vaccine, as it says that the NACI also suggests that the governments be completely transparent with populations and communities about the vaccine, because, we've heard, I'm going to call them conspiracy theories, where people have been vaccinated with vaccines that they don't even know about. They don't even know what the effects are. They don't even know what they're being vaccinated for. The NACI is saying, do not do that to the Canadian government, and saying instead that it's important that we ensure that education is as open and transparent as possible for all communities, especially marginalized communities who may not necessarily have access to this information readily and easily. So that's something that they've also recommended. Now, the unprecedented nature, the NACI says, of this pandemic and vaccine development efforts has led to a highly competitive global landscape of vaccine access, which basically means that almost everybody in the world is trying to, as quickly as possible, find a vaccine that is effective. Now, they said that efforts should be made to increase access to immunization services to reduce health inequities, as I mentioned before, without further stigmatization or discrimination, and to engage systemically marginalized communities, as I mentioned before. Now, these health inequities exist, according to the NACI, due in parts to differential access to healthcare, as well as differential exposure, susceptibility, and severity of infectious diseases. So essentially, we do know that there's healthcare inequity all over the world, but especially even in Canada here, that there are some communities that do not receive the necessary healthcare that they're required for various reasons, because they do not have ready access to the healthcare providers or healthcare services that's required. They do not know about the healthcare services that are available to them. They are not sure about what to do next, how to approach, their necessary healthcare needs, if you will. So it's important, according to the NCI, that we recognize this, especially our government recognizes this and ensures that they're doing their part and doing their best to ensure that they're educating those who may be part of these marginalized communities, those who are facing some kind of healthcare discrimination as well, whether racially or socioeconomically, that they too have access to the necessary healthcare. Because it's important that once this vaccine is public and available to everybody, it's important that those who may not know about it do get the opportunity to immunize themselves, so long as they want to, because we know that there are some people who may not want to get the vaccine because they, the anti-vaxxer fear, if you will, of the consequences of being vaccinated. But that everybody who is wanting this vaccine has access to getting it. Now, the NACI also goes on to say that interventions to reduce these inequities rather than potentiate them or to increase them with further stigmatization or discrimination should be implemented as part of any immunization program. So this should be part of the rollout plan that the government would have for this vaccine, that those communities should not be forgotten anymore, that it's important that all of these factors are considered when thinking about a plan to roll out this potential vaccination. Now, I'm giving you all this information today because I think it's important that we all understand what the potential is for this vaccination. It's important that we also understand what it might mean. You know, we had reported previously that some scientists had said that we might not see the whole world be vaccinated for at least another 4 to 5 years. And though it feels a little soon that we're seeing a vaccine with such a high effectiveness rate, it could possibly mean that, you know, we won't have access, like the whole world will not have access to this vaccine for another few years, which will also mean that even though your country may have access to the vaccination and the vaccine, others may not, or most of the population may not. So it's also important to factor that into our hopeful planning of this potential vaccination. I know a lot of people who are just excited to get it and saying that as soon as it comes out, they want to be first in line to get this vaccine, that they want to be able to go back to how they were living their life before and not having to worry about COVID-19. But again, I want to reiterate that there is still so much data that still needs to come out about this particular vaccine that Pfizer has, you know, been working on and is in the clinical trial phase and still seeking approval from the US FDA for. There's still so much that we still need to understand about this vaccine. And with that, you know, it's going to take some time for our healthcare providers and officials to understand it, and then also our governments to then relay the information to all these key populations and to, you know, just the whole population in general, before we start maybe seeing this vaccine becoming public and available to us publicly in general. So though we're excited for this future, to basically quickly just answer the question if we have finally found a cure for COVID-19, the short answer of it is kind of, yeah, I guess so. But we still need a little bit more information just to understand, you know, the characteristics of this vaccine. It's still uncertain whether there are side effects of the vaccine that will be detrimental to other people's health, especially those who may have some pre-existing conditions. There's still some data that needs to come out, that needs to be understood, that needs to be relayed as well to the necessary parties who are involved in, you know, rolling out the potential vaccine program. So, yeah, I mean, with all this being said, we are hopeful. We are hopeful that this is the beginning, you know, the beginning to, I guess, the end of COVID-19. We are hopeful that this means that, you know, we're seeing the potential for a cure faster than we could have thought we would be. But it's also important to remember that, as I said, it may take a few years before all populations will be able to get vaccinated, before we start seeing it become, you know, like the flu shot that you can get at Shoppers Drug Mart really quick and easy. You know, that might take a little bit of time before we see that happening. But, you know, we're still holding out onto hope. We can't let go of hope just yet. I mean, a 90% effective rate is high, and it's promising, but it's important that we also just wait a little bit longer just to get a little bit more of this data that is required to just understand the characteristics of this vaccine, and also waiting on how our government plans to, you know, roll out these vaccines and what program they have for immunization for all communities within our country and even across the world. Because I know a lot of us really cannot wait to start traveling around the world again, but if only one country has, you know, the potential to vaccinate their full population, and then you want to go to a country that isn't, and you have risk of, you know, contracting the virus there. We still don't know if, even if you are vaccinated and you do come in contact, what the side effects are if you do catch COVID-19 again. Because, you know, when you get the flu shot, and sometimes you do get the flu as a result of the flu shot, and then, you know, you have the antibodies to fight it off. We still don't understand what that process is like for this particular vaccine. So, again, we think that there is a cure. We're hoping that this is, you know, the start for something new. We're hoping that this is the start of the cure for COVID, but there's still so much to consider. And even with this recommendation from the NACI about the rollout for the immunization program as well. Now, with that being said, that concludes our show for today. Thank you so much for tuning in to the Chatt Up Show. As always, it was so nice chatting with you. And you know, you can always keep up with the GBKM network in various ways. You can continue to listen and watch live at www.gbkm.fm or www.gbkm.tv, where you can also catch up on past shows or check out the upcoming shows. Like, share, comment, subscribe, all of that fun stuff. You can still watch us on Facebook at GBKM Television and YouTube YouTube at GBKM TV, again, where you can like, share, and subscribe. And you can follow us on Instagram at GBKMFM and Twitter at GBKM_FM. And again, our Chat Up Show sponsor, Coded Signature. Use GBKM as a code for 10% off at checkout at codedsignature.com. That's coded with a K. And you can check them out on Facebook and Instagram at Coded Signature. Again, that's Coded Signature with a K. And you can follow me, your host, Elizabeth, TIS_Liz_O on Twitter and Instagram. And I will see you at the same time, same place next week. Take care.
Do you know who you are? What is your name?
Sometimes you wonder why and wonder how. Don't be alarmed, just stay calm, cause even if you choose or not to.
My child, recite the words of this ancient mythology. The wisdom I disperse in this verse, no apology. Memorized to keep you from evil theology. For you, the dark of you, denied your equality. See, for generations we perpetrated psychology. Divide and conquer each other, really lynch policy. You cannot build each other up, how will you build economy?
GBKM TV, the station with a vision. GBKM TV, the station with a difference now. Slim Flex said so. Big